The metabolically stressed patient, the first response is going to be the ebb phase. It is going to be characterized by hypovolemic shock. There's going to be a decrease in tissue perfusion, decreased metabolic rate, decreased oxygen consumption, decreased blood pressure, as well as a decrease in body temperature. The second phase is the flow phase. There are two parts to this. It is acute and then adaptive. With the acute, catabolism is going to dominate. We are going to have an increase in glycocorticoids, glucagon, catecholamines, an increase in the excretion of nitrogen, increased metabolic rate, and oxygen consumption. In the adaptive phase, we're going to see that anabolism dominates. You're going to see a decrease in the hypermetabolic rate and in the hormonal response. This phase, it deals heavily with wound healing and depends on intake for the speed of wound healing, and it's also associated with recovery. Head injury, you're going to see patients that are in a hypermetabolic and catabolic state. The more severe the head injury, the more you're going to see a metabolic response. You're going to see a release of norepinephrine and epinephrine. There's going to be a decrease in B vitamins, vitamin C, and zinc, which means that the patient will probably want to be supplemented with B vitamins, vitamin C, and zinc. As for MNT, you're going to see a 40% increase in energy needs, and protein, the estimated requirement is going to be 1.5 to 2.2 grams per kilogram. Major burns. The formula that we are going to use is 24 kcals times kilograms of usual body weight. You're going to want to add that to 40 kcals times the TBSA, which is the total body surface area that was burned. And that will give you the formula for caloric needs for burn patients. When you have patients that have 50 to 60% of their body burned, there's a great increase in mortality, but there's not a lot of increase in nutrient needs. We are going to see for most patients 20 to 25% of total calories need to come from proteins. They need to be high biological value proteins, and a lot of the protein is lost to the wound healing and excreted through the urine. Arginine and glutamine are two amino acids that can be supplemented that help. Arginine increases the immune function and helps with wound healing, and glutamine helps neutrophils, which are an immune response to kill bacteria. Spinal trauma. In acute spinal trauma, we're going to see a hypermetabolic and catabolic state in patients, and in stabilized patients, it's going to be hypometabolic. The higher the injury on the spinal cord, the less energy expenditure that the patient's going to see. We have both weight and energy equations that are used for both a paraplegic and a quadriplegic patient. For paraplegic patients, you want to look at a 10 to 15 pound decrease of BMI. And then for a quadriplegic, it's 15 to 20 pound decrease from the BMI. And then for energy requirements for a paraplegic, again, we're going to have a 28 kilocalorie per kilogram adjusted body weight energy need. And then for quadriplegic, it would be 23 kilocalories per kilogram of adjusted body weight. Protein requirements for acute care, you're going to be looking at about 2 grams per kilogram of body weight. And then for maintenance, we are looking at 0.8 to 1 gram per kilogram. For a patient that has pressure ulcers, you want to increase that to 1 to 1.5 grams per kilogram. There are a couple complications that can come along with this. They're going to be obesity, constipation, osteoporosis, and pressure ulcers. And in sepsis and systemic inflammatory response syndrome, sepsis, you're going to see infection with an identifiable organism. And then with SIRS, you're going to see inflammation with infection or pancreatitis, trauma, burns, ischemia, any of those. What's characteristics of these is hypermetabolism, hyperglycemia with insulin resistance, lipolysis, and protein catabolism. And as for MNT, you're going to want to supplement with 25 to 30 kcals per kilogram or 1 gram per kilogram protein requirements. For multiple organ dysfunction syndrome, it is a complication of SIRS. It begins with respiratory failure, and then it'll progress on to liver, intestine, kidney failure. Some complications are going to be massive edema, and you are going to see a decreased plasma protein concentration. It's seen with SIRS because of the disruption of the gut barrier function, and it's going to cause inflammation and possible bacterial translocation. And for this, you can supplement with glutamine, and that'll help. So now we have 3 questions that deal with these few situations. We have our first question: is anabolism or catabolism associated with the adaptive flow phase in a metabolically stressed patient? And it's going to be anabolism. It's going to deal with wound healing, increased nutritional needs. All right. And then what amino acids are important to patients with major burns and why? And that is arginine and glutamine. Arginine is going to help with wound healing and increasing the immune system and helping that out. Glutamine is going to help the neutrophils resist against bacteria. And our last question is: give 2 examples of change with sepsis or SIRS, or changes you are going to see in a patient. And that's going to be hypermetabolism, hyperglycemia with insulin resistance, lipolysis, or protein catabolism.